Infections. They can be debilitating, bothersome, miserable, and they can range in severity, from an ear infection to a sinus infection, a staph infection, and HIV. In this video, you'll learn about infections, what they are, how they can affect your body, and most importantly, how to fight off and prevent infections. First, it's important to understand what an infection is. An infection is damage caused to your body from germs. It happens when your body is unable to protect itself from those germs and microorganisms. There are 4 types of germs that cause infections. The first is bacteria. Bacteria are tiny single-celled creatures that cause infections like pneumonia, sore throats, sinusitis, and ear infections. Next is a virus. These are organisms that depend on a living cell to live. Viruses cause infections like the flu, chickenpox, measles, and mumps. A fungus is the third type of germ that can cause an infection. Fungi are organisms that grow on damp, molded environments. It can cause infections of the nails and itchy skin rashes. Finally, there are protozoa. Protozoa are larger organisms and include intestinal worms, which causes infections like malaria. Infections differ in severity. Some are minor, and some can be deadly if not properly treated. Infections can also affect your entire body, not just certain parts. A fever is usually the first sign of a total body infection. Our bodies are infection-fighting machines. At first detection, our white blood cells go into action to try and fight off these germs. But sometimes our white blood cells just aren't enough. That's when your doctor steps in with antibiotics to give your white blood cells more ammunition to fight the infection down. Many infections can be spread by blood or body fluids. HIV and hepatitis B virus are common examples. However, infections caused by other viruses and bacteria, like syphilis and hepatitis C, can also be spread by blood or body fluids. That's why infection rates in hospitals among patients and staff are becoming a real problem. 1 out of every 20 patients in a hospital will contract an infection. Hospitals are working on ways to reduce that staggering trend. But there are some things you can do to prevent infections at your work and home. First, always handle, cook, and store food properly. Many infections are caused by foodborne illnesses like Salmonella and E. coli. Always get recommended vaccinations for you and your kids. The Centers for Disease Control says 56% of kids aren't fully immunized by age 2, and only 10% of kids in the United States have been properly immunized. These shots are the key to preventing certain viruses and infections. The CDC says there are 11 diseases to vaccinate against. That averages out to 16 doses, but only requires a maximum of 5 visits to the doctor before a child's 2nd birthday. Wash your hands often. Many infections and viruses are spread by hand-to-hand contact. Experts recommend using soap and water for 20 to 30 seconds for proper disinfection. If you need a good judgment of time, imagine singing Happy Birthday to a friend twice through. Then, dry your hands using a paper towel or air dryer. If possible, use your paper towel to turn off the faucet. If soap and water aren't available, use alcohol-based hand sanitizer to disinfect your hands. So what do you do if you already have an infection? First and foremost, you should see your doctor right away to determine if you do indeed have an infection, what kind of infection it is, and how it can be treated. Not all infections can be treated with antibiotics. Viruses like the flu, colds, and sore throats are best treated with rest and plenty of fluids. But using antibiotics to treat bacterial infections like some sinus and ear infections are necessary and will speed up recovery. Just remember, if you do receive antibiotics for a bacterial infection, be sure to take the medicine exactly as prescribed by your doctor and continue taking the medicine for the number of days prescribed. Even if you start feeling better, finish your prescription. For infections, It takes a certain length of time of exposure to a drug in order to kill the bacteria or virus. If the right dose is not taken for the correct length of time, some of the bacteria or viruses may survive, multiply, and cause the infection to reoccur. Also remember that you are what you eat, and eating better will make you feel better. Nutritionists say eating healthy and nutritious food helps make your body stronger and better able to fight off infections if you get one. Exercise is also vital in making your body stronger and better able to fight off germs. And finally, be courteous to those around you. If you have an infection, avoid others and get rest. If you absolutely must go out, use hand sanitizers and cleaners to disinfect anything that family, friends, and coworkers would touch. And avoid hand-to-hand contact. Also, be sure to let others know about your infection so they know to use caution when they're around you. Infections can be deadly if ignored, but they can also be easily treated. By following these simple steps and precautions, you can be assured that you and those around you will live a healthy, happy life.